Welcome. Awesome topic tonight. It's something I've devoted the last few years wherever I saw a symposium of late-breaking research on Alzheimer's, cognitive decline, neurological conditions, was there. We did a lot of work in this one. There's an incredible amount of information that I had to plow through. What I tried to do with this seminar is quote, and you'll see a lot of quotations on the bottom, of the very top tier medical journals, because I know what I'm going to talk about is going to be controversial. But isn't that how change comes, right? It's always a little controversial at first, and there's going to be some pushback. But I can point to the very medical journals that these specialists use themselves, say, look, it's published here, 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 here's your evidence based on very large studies. It's just people have to pull it together instead of just looking at one of the studies. A big shout out goes to Dr. Dale Bredesen. Dr. Dale Bredesen is a very brilliant researcher and as well as clinician who first published in the year 2014 a groundbreaking paper on 125 patients with moderate to a little bit more severe cognitive decline, so Alzheimer's patients, and showed an over 50% cure rate in these patients. And of course, you can imagine the firestorm that had erupted. And I'm giving him a big shout out because he had discovered functional medicine a year and a half before this. And functional medicine basically makes you be part of the playground of all of medicine instead of just segments of it. So you're playing with gastroenterology, endocrinology, neurology, I can go on and on and on, all the specialties, and you then get to pull from all that richness this and this and this piece of it and apply it to the patient. So he was like a little kid in a playground discovering this, and I watched him again in Los Angeles this weekend where he spoke, but also attended the International Functional Medicine Institute Symposium, the International Gathering rather, and he was just enthralled. He was sitting there just soaking it all up, because for a doctor like him, it gives answers that they never thought was possible. He was able to apply this, able to prove the reversal of Alzheimer's disease, and published it, and finally made it safe for me to say confidently, yes, you can reverse Alzheimer's. Had I done that 3 or 4 years ago, I would have been labeled as a cook, wouldn't I? Right? And a kook, yes. So, because I had seen it happen here at DBC. And I will tell you a case study towards the end of that. So whenever I got the question, Doc, can you treat Alzheimer's? I would also be a little more cautious. You know, there's a lot of things we can do to help. That would be my standard answer, without saying we can cure it. It's because I was afraid of getting that label, right, and then be dismissed by a patient like that. Evidence is out there. Let the journey begin. Let's explore this thing. Another shout out to Dr. Pizzorno. Dr. Pizzorno established the most well-known naturopathic school here in the United States I believe he established it in the late 1970s. It's a world-class institution today. Bastyr College throws off so much information that it seems like no one can keep up. And it is really well done research, and I'm going to present some of his research as well. Here he is, he's close to 70, around 70, touring Australia just this past year. That's his extended family. Little guy on the left is him. On the far right, you see his great-grandpa. He's 94 years old here. Straight from Italy. He was the herbalist for the village there. However, there's not enough sick people to make a living. So he also was a cobbler. He, at age 95, was at a picnic in perfect health. And he was looking around him with satisfaction at his extended Italian family. He was just telling us this 2 days ago. And he said, you know, I've seen my kids, grandkids, great-grandkids. He had 20 of them at that point, grandchildren, grandchildren. And he says, it's time for me to go. Stopped eating, died a week later. In perfect health. His son, standing next to him, lived to age 88. However, had several hip replacements and suffered from ill health the last 20 years of his life. Was more westernized, exposed to more toxins. Dr. Pizzorno's dad, he's the young fellow with the flashy suit there, totally embraced America. Says, I'm going to get rid of this Italian stuff. And apparently he was a fast food addict. He was in a nursing home in his early 60s already. Same genes, folks. Yeah? Had multiple hip replacements as well. Did live until his 80s. Thank you, Western medicine. But not really. And does not remember the last 10, 15 years of his life. And here's his son. If you see him, he looks like a kid, even though he's 70. Yeah. Our way of doing medicine is doing us in. Our way of living is doing us in. And we're going to talk about that. The classic medical exam for Alzheimer's today is do an MRI, do a CBC, that's just a very basic blood panel, thyroid, and check B12 levels. Based on that, said, yep, you're forgetting everything. I'm going to give you Aricept. It's the most popular drug for Alzheimer's. Has never proven to work. It does nothing to slow down Alzheimer's. It is not at all effective. The very best study we have shows that you can maybe buy 3 or 4 weeks on a rapid declining Alzheimer's. In other words, you push it back 3 or 4 weeks. That's the very best study. It doesn't work. The doctors do not test genetics. This is huge to know what kind of genetics you're dealing with. Genetics do not determine outcome, but it sure is good to know what your genetics are in a case like this, so you know which way you have to live kindly, so that the good genes express themselves. Yeah? They do not check C-reactive protein, which is an inflammatory marker, or inflammatory testing period, and there are dozens of them. Homocysteine levels is absolutely critical. It's affected by B vitamin metabolism and other things. Hormone panels is absolutely critical as well. What if you're severely thyroid deficient? It will affect your brain like mad. I'm just giving you one example there. We know, for instance, with an oophorectomy where ovaries are taken, if it's done before the age of 40, your chance of getting Alzheimer's is 4-fold. Yeah? So there's some very shocking statistics. So is a hormone panel important? You better believe it is. Toxicity panels. We're going to talk about toxicity. Right? I think that's part of the problem with that Pizzorno family, is that they're exposed to increasing amounts of toxicity. Insulin levels is huge. How about your gut? It's your second brain. Houses 92% of your neurotransmitters. You think that if something's going on over here, it might affect you here? Right? MRI volumetrics, that's checking volume of the brain. On and on and on. None of those things get done. So how can you effectively treat someone if you don't know what's going on? Right? You just cannot. So are we breaking through to an Alzheimer's disease cure? Not really. You'll see many drugs that they're trying to approve right now, and all they are doing is working on the amyloid plaques, the neurofibril tangles, tau, all the inflammatory things that are happening in the brain. And they're trying to get rid of that, thinking that's what causes Alzheimer's, and I'm guaranteeing you they are wrong. In fact, removing those will worsen Alzheimer's disease symptoms. So what would the perfect Alzheimer's drug look like? It has to do a few things. And I'm not going to read all this out, but you can see the incredible complexity of what we know today about Alzheimer's. Right? All the different hormones, the inflammatory markers, the way the genetics express themselves, just basics like vitamin D. It has to affect all those. I would not hold your breath for them to figure out how to make this medication. It will never happen. So we're going to go into some topics here. For once, I tried to be organized. We're going to go into the why, different stages, prevention, reversal, which nutraceuticals are useful, and then conclude it. Then we'll address questions after that. So why? Harvard researchers using Framingham data shows that there's a higher than 2.5 parts per million particulates. It leads to smaller brain volume. It's pretty dramatic, by the way. This is air pollution. Or if you work in a body shop. Or I can go on and on. As I was looking out over LA this weekend and saw this thick layer of smog, I thought, wow, it'd be interesting to do a study on Alzheimer's disease incidences in Los Angeles, wouldn't it? It has a very significant impact. Why? Well, one, it's a toxin. Toxin causes inflammation. Inflammation is bad for everything, right? That's kind of basic. But another reason, and this is really interesting, when you have small little particles, they attach to something called a cribriform plate, and that sits right behind your nose here. And it activates the cribriform plate to send inflammatory signals directly into the brain, causing direct inflammation in the brain. It's a direct response. And you do that repeatedly enough, you will start destroying the brain because you activate the immune system within the brain. The immune system, by the way, your brain has its own immune system, by the way. It's really kind of cool how that works. But if it becomes overactive, it's almost like an autoimmune disorder. It starts destroying things. And that's when things go down. That's why these pollutants can be so bad. So even living within 50 meters of a major highway leads to a 10-fold increase in Alzheimer's disease. Okay, this is a Canadian study that was well done and published in Science magazine in just this year. Okay. Also, there's neurotoxins. This is Dr. Pizzorno's work. Okay, he was joking to us about it, and it was kind of funny, but it was not, because this is hour 12 of lectures, everybody presenting and throwing stuff at us. He says, well, I know you're tired, but I've got 12 hours worth of research here I'm going to present to you in 1 hour. And he did. He just flew through it, and we're going, oh, this hurts. This is some of the stuff that he went through. If you're sitting there listening to a thing, to his presentation, you're going, oh, we're doomed. The amount of toxin increase in the last 40 years is shocking. It is absolutely shocking. And the problem with these toxins is they accumulate, they stick to us, they get stored in our fat cells and bone cells and all that. And if you happen to have that and you become pregnant, 20 to 30% of those toxins get passed on to the newborn before they're even born. This is why you can see successive generations becoming more and more and more ill, because there's an accumulation of toxins from great-grandmother and great-grandpa, and on and on and on. It just gets concentrated more and more, plus our increase in pollutants around here. In fact, Dr. Pizzorno says, I'm going to be politically incorrect. He says, this is a much greater problem than global warming will ever be. He says, because it's an immediate problem right now, affecting our very population right now in a big way. autism, which really this could be a talk about autism too. You could just translate it, or MS, or Parkinson's. Yeah? Autism right now, at the current level that it's increasing, by the year 2022, which is not that far away, 1 out of 2 births will be in the autistic spectrum disorder. I don't think it's going to go there. I don't. Because that's just if you take the curve linearly, and usually it goes like this more. But still, they're shocking statistics, because when I started practice, it was 1 in 22,000. Now it's 1 in 64. In some areas, it's 1 in 30, like on the East Coast. Yeah? So it's obviously something is very, very wrong in our environment. And some of that is the mercury levels, the pesticides, PCBs, phthalates. Roundup, fully banned in Europe for a very, very good reason. Did you know Roundup is actually a very potent antibiotic? That's how it works. And residue on our crops destroys the gut, which then signals to the brain. And what's even worse, some of the bacteria that lives inside of us, they start producing Roundup on their own. They get smart and says, this is an interesting chemical. And now you've got bacteria that actually will produce Roundup nonstop in your gut. The stuff is absolutely evil. It's used indiscriminately in this country. There are some researchers that say that it is behind the autism epidemic. Myself, it's probably part of the story. It's multi-layered, just like Alzheimer's is. You go, PCBs, well, that got banned long ago. Or how about DDT on the other side? Got banned, I think, back in the early 70s. Levels are still incredibly high in our environment and in our bodies. DDT is a major problem. Cadmium production is going through the roof. It is an incredible neurotoxin. When you look at worldwide production, it is doubling about every 3 years. So cadmium is a really big one. Lead, we know enough about lead. Mercury. Mercury is one that really applies to us, because when you look at Grand Rapids, we are in the very top of the nation for mercury emissions. We secrete tons of it in the air every year. Muskegon, cement plants, is where it's coming from. And unfortunately, the prevailing winds go this way. So when we do a heavy metal urine analysis in this office, even with babies, we are seeing heavy metal concentrations that are totally unacceptable. It's a very common finding here at DBC. Cadmium, not as much. Lead, hardly ever see that, fortunately. So mercury, right here, is extremely common, and the half-life of mercury is incredibly long. In other words, it takes a long time for it to be cut in half. We're just finally seeing declining levels in Lake Michigan. Just finally. They've been having cleanup efforts since the 70s, as you know. Groundbreaking, some of it unpublished yet. And I get this sneaky little delight giving you this information, because you're seeing this way before any doctor will, and before it becomes public. So probably 15 to 20 years before this becomes common knowledge. But infections apparently are becoming a huge factor in the development of Alzheimer's. And a lot of these are what we call latent infections, and a lot of them are viral, not all of them. For example, herpes simplex can reactivate in the brain 60 years after it happened and create havoc. And I know some of our European mentors, Dr. Vogel specifically, was always talking about a viral load. And he believed, wrongly, but in a way was right, that it was viral particles that were left over that would just accumulate and eventually create such a toxic burden that created illness later on in life. Now we know it's not viral particles, it's actually the viruses themselves that stay just quiet, dormant, and you get layer upon layer upon layer upon layer until finally the immune system can't hold it back anymore, and that's when you get these secondary infections. and that's what can happen to your brain. It is very much associated with leaky gut syndrome. I talked to the fella that made me pretty much fall off my chair 7 years ago, also in LA, Dr. Gary Mullen. He is an Ivy League professor. He's a highly regarded gastroenterologist and researcher. And I said, you know, you made me pretty much fall off my chair 7 years ago. I told him that this weekend. He goes, why? He says, well, you mentioned the word leaky gut. And he just started laughing because I had stopped using that word, even though it's been in use since 1890. Because everybody was going, what? Never heard of that. That's weird, right? So I would just use more sophisticated terminology like gut dysbiosis, and which basically, you know, it's basically the same thing. He says, no. He says, I want you to know something. This word leaky gut, I have stopped using it. My department has asked me to stop using that word because we're giving credence to those that have used it before us. It's not politically correct to use leaky gut. He says, I'm using it to this day, and he says some of my colleagues are very much opposed to me using it. Thought it was interesting. So, leaky blood-brain barrier is a really important one also. We have this little filter that sits right below our brain, so that the stuff that's found its way into our blood, and that is evil, cannot go into our brain and cause damage there. So it's like an extra filter. Eventually, if it gets assaulted enough, it will become leaky. And now, if we eat something that's bad and has chemicals in it, it has direct access to our brain and can cause immediate inflammation. So a leaky brain barrier is also very much a problem. Here's another interesting little tidbit. This was published in Journal of American Medical Association, Neurology, February 15, 2016. Shows that proton pump inhibitors, so your acid blockers for heartburn, if you use this, your dementia risk goes up by 44%. Why? It's because you're altering the gut environment dramatically. You're altering the way you break down foods. Right? You're no longer breaking it down like you should. So you start fermenting foods, you get bad byproducts. Not only that, you're allowing in free passage of yeast, bacteria, and all kinds of other things because you no longer have this disinfecting sink here. This hydrochloric acid is so unbelievably acidic, it's more acidic than battery acid. Yeah, it's unbelievable when you think of it. So anything that comes in gets killed immediately there. So it not only does it break down the food, but it also is a disinfectant and it won't work when you're taking that. So, bit of a problem. And I can go on and on and on. Insulin resistance is another really big one, where the high insulin response to too many carbohydrates causes an inflammatory response, which then affects the brain also. It's not called diabetes of the brain for nothing in Europe. Alzheimer's is often called diabetes of the brain. It's a major 21st century factor. And we could sit here and discuss all these factors. I just pulled out some of the more interesting and prevalent ones. Dr. Bredesen, with all this information that's out there, has subdivided cognitive decline in 5 stages. This is revolutionizing how we understand Alzheimer's. And from this, you'll also see why one pill is not going to do it. So these subtypes determines how the physician and the patient will attack the problem. It's really, really important to be able to classify where you belong. So type 1 is inflammatory. He calls it hot. And this is obviously inflammation of the brain. Very autoimmune-like. Patient usually has other hot symptoms throughout the body. It's not just the brain. Easy to spot, honestly, as a physician. Very easy to spot. Type 2 is trickier. Atrophic or cold. This is the one that I mentioned, that if you have an oophorectomy, ovary removal by 40 or below, your chance of Alzheimer's goes up very dramatically. It is hormone depletion that causes this kind of Alzheimer's. It could be testosterone levels. It could be your thyroid has gone south. Hashimoto's, low thyroid levels, real common one. Adrenal fatigue is a real common one. So anything that causes hormone depletion is type 2. Type 1.5 is between type 1 and 2. They often go together because inflammatory could be due to insulin resistance, right? And insulin resistance can deplete the adrenals. So it's kind of and he calls it glycotoxic. So it's basically sugar and toxicity combined. That's what that one is. Then type 3, toxic, he calls it vile. Love that one. And that one is all those neurotoxins that I talked about. Could also be leaky gut though. But it could also be somebody who owns an orchard, has been spraying a lot, right? And now has this issue, or mercury toxicity. If you have 14 amalgams in your mouth, it is pretty much inevitable that you will have mercury toxicity. The second leading cause is actually fish consumption. Vascular calls it pale. It's a very simple one. Decrease of blood flow to the brain. Less oxygenation, less nourishment. This is a slower developing dementia. Cold hands, really bad circulation. Easy one. Okay, you listen to the carotids, you hear what's called bruits, which is an interruption of the blood flow. And it's really often associated with strokes and cardiovascular issues because those are the ones that suffer, those blood vessels suffer as well. And type 5, traumatic, dazed, concussion, right? Professional boxers, the risk of Alzheimer's is incredibly high. Football players, same thing. Cyclists that have crashed. Anytime you have had 2 concussions that have been documented, your risk of Alzheimer's goes up very measurably. So this is not to be underestimated. I had a patient, when I'm thinking about it now, talk to me, she said, this whole concussion thing seems a little overblown. And he was right in a certain way because it seems like there's a new fad every year, and everybody's on it. And right now, we're really focusing on this, but it's an important one to focus on because in old times, these concussions, you could maybe laugh them off. But not anymore. Not in the inflammatory environment, the toxic environment that we live in. Little things can become big things really rapidly. And it might be the last trigger that the brain needs to go into full-on Alzheimer's mode. So concussions are definitely to be taken very seriously. So let's talk about preventing these different stages. What do we do? Exercise, my favorite topic. In this case, aerobic is best. Aerobic is best. There is no clear consensus yet, according to the Journal of Alzheimer's Disease, what kind of aerobic is best. Is it interval training? Is it fast walking, slow walking, bicycling, fast? Just go aerobic. We don't even have a time thing on it. But why don't we say a half hour a day? Because I know that's where growth hormone gets secreted, anti-inflammatory effects are present. And it measurably increases brain volume, especially the hippocampus. The hippocampus is a part of what they call the primitive brain, not so primitive, which sits right through here. And the size of the hippocampus is the most accurate predictor of how we're going to do with Alzheimer's, yes or no. And because we now know that the brain is constantly reinventing itself, producing new neurons and new connections and new neural pathways until we breathe our last breath, it can regenerate. The notion that medicine is telling us that once pieces of a brain is dead, it won't come back is totally false. Been disproven. I've seen multiple markers in the brain showing regeneration, MRIs. It's really clear to the naked eye even. So volume can come back given the right environment. And exercise therefore decreases risk by 50%. Find me a drug that does that. Yeah?
No side effects.
So, probiotics. And I was really amazed at this one. It's only a 12-week trial done in neuroscience last year. And it shows that some of the most important markers for inflammation in the brain were reduced dramatically in just 12 weeks. And these were off-the-shelf probiotics that aren't even that good. So, amazing study, and actually quite groundbreaking. Really, we're taking care of the gut, aren't we? Remember, the gut is the second brain. Genetics, CD33 gene, TREM2, there's also something called ApoE4, multiple genes that we know that promotes inflammation specifically in the brain when they're turned on. So we should have a lifestyle that if we know we have this genetic predisposition, and that will be another topic later this year, that's just going to go through genetics, we need to shut them off. And they can be shut off. Your genes do not at all determine your destiny, at all. It's just good to know about them because they show you the pathway that you will drift towards if you have a bad lifestyle. It should be a motivating force to behave yourself. Right? And if you do, they are shut down. So, lifestyle changes and base nutraceuticals, as we now know about them, and I'll cover in a minute, is clearly the most effective way to prevent Alzheimer's. There's many of them, and there's one that I'd like to also go through. Learning a second language reduces Alzheimer risks dramatically. It's just so simple. You're exercising the brain. And the brain, given the right circumstances, when it gets exercised, responds exactly like a muscle. I've seen compelling research at brainhq.com. The founders of that showed compelling research that shows that at 85, you can rehabilitate the brain so that it's equivalent to that person's 25 and better. Higher processing speed, higher IQ at 85. Average time that it took to do that, 6 months. Amazing. So it's amazing how you can change your brain. BrainHQ.com is the one that was used as an example that has the most evidence behind it. Phenomenal. Absolutely phenomenal. So all functions of the brain are reversible. All of them. Cognitive decline is early Alzheimer's disease and its forerunners, mild cognitive impairment, subjective cognitive impairment, are reversible and improvement sustainable using a programmable approach rather than a monotherapy. What do I mean with that? The programmable approach rather than monotherapy. Monotherapy is using a single agent, just one thing. But now you realize that Alzheimer's is many things, right? It's a compilation of many things that ultimately results in brain destruction. So you got to go after most of those. You don't have to go after all of them, but you have to go after the big ones. Eating organically grown foods dramatically decreases neurotoxins, dropping blood levels measurably within just 3 days when organic foods are eaten exclusively. I was really heartened when I saw this research. In just 3 days, you could start clearing things out just by eating differently. Evidence was also presented at the symposium that one of the dirtiest vegetables, when you don't eat it organically, is kale. The new fad superfood. Kale just absorbs pesticides like mad and concentrates it in its leaf. Eat that one organic and has tremendous health benefits. It does, but don't eat it conventionally. Another way to reverse it, and this is almost a must-do, is up-regulate glutathione. If there's one common thing among all the different Alzheimer's, it is reduced glutathione levels. Glutathione is the magic little molecule that acts like a magnet for inflammation and evil particles. It's our major cleanup molecule. And if we can get more of that in the area where the battle is occurring, it cleans up, doesn't it? Upregulating glutathione is rather controversial. There's a lot of glutathione supplements out there. They don't work. None. Glutathione done IV does work to some degree. Dr. Perlmutter, a really well-known neurologist, I spoke to him this weekend, and he's doing it via IV in his Parkinson's patients. And he has some very dramatic reversal in just a matter of weeks with IV of glutathione. However, he confided in me, there is a problem. The moment you stop, everything comes back. Everything comes back, and it is very, very expensive, so not sustainable long term. But if nothing else, it shows you the importance of glutathione. It binds to mercury, persistent organic pollutants. The best way to pop up glutathione is to use N-acetylcysteine. And those are some of the base products that we use for treating Alzheimer's. Again, exercise is not just a good preventer, but it's also a good treater. It increases hippocampus size, it increases hippocampus blood flow, increases memory. Again, aerobics best. And here I have to give credit to Dr. Wall. She has reversed an incredible case of MS, where she was in a reclined wheelchair, unable to function, teaches at University of Iowa Medical School, and this medical doctor decided to take things in her own hand because obviously things were going south very quickly and she was non-functional. And she devised a very, very powerful anti-inflammatory food plan that was super rich in vegetables. This is what she eats. 3 cups of greens a day, 3 cups of colored, mostly vegetables a day. For example, the beet that is showing up over here, that's a really, really potent one. And 3 cups of sulfur-containing items, which really upregulates liver function, as well as kidney function. Very important for some neurological pathways. Along with that, there's grass-fed beets, organ meats, and wild fish. The organ meats, I know I'm going to get pushback on this one. In Europe, it's very common. It's what I grew up with. But organ meats can be incredibly, incredibly rich in nutrients. However, they also tend to concentrate toxins. So it's got to be organic, grass-fed. Okay? Very important. The fish has to be wild. Now I want you to note the picture of that fish. That's not wild. That is what farm-raised fish looks like. You see how far apart the white lines are? That's just a fat fish loaded with toxins. You don't want to touch that one. It's got to be wild. Become an expert at spotting fish. There's a lot of fraud out there. A lot. Basically what this is, it's an enhanced ketogenic diet. And it is an incredibly powerful tool for any neurological condition, whether you're talking MS, Alzheimer's, Parkinson's, on and on I go. Even just cognitive decline. Cognitive decline is so common. I have so many patients that come to me. I bet you 1/2 of my new patients complain of brain fog. That is cognitive decline. That is the beginning stage of Alzheimer's. Possibly. Probably. So, you need to go ketogenic, which means no refined carbs. Watch the fruits, very high in fats and good proteins. And what carbs you do have, very rich in phytonutrients. We call it Nourish in this office because there's a lot of ketogenic diet out there that are very unhealthy, lots of bacon and blah, blah. And so there's really not much nutrients in those, and of course you cannot do that. There's different ways of doing this. Some people do this for 6 months and then relax the rules for 6 months, kind of going with the seasons a little bit. Mimicking what in old times we used to do in the winter, where we were a little bit more meat heavy and less vegetables, and in the summer we had more vegetables. So kind of mimicking that thing. Others, and this is what I prefer, is really be very, but when you're first doing it, you have to be very strict. But let's say after 3 months, for 5 days you can do very strict ketogenic, and then 2 days of the weekend you can relax a little bit. So you slip out of ketogenic and then go back in again. That is also a very effective treatment for Alzheimer's. So there's many things you got to go after. You optimize nutrition, right? You re-nourish. Balancing hormones, I've not spoken about that, but that's a whole other big topic, but that's absolutely critical. So figure out where the hormone depletion is occurring, reduce inflammation, whatever its cause is, and leaky gut being probably about 80% of them, and insulin resistance going right there with it. Fix the digestive tract. One thing that we do with virtually every single case of Alzheimer's is give them Metagest, beta-hydrochloride, and pepsin, that's what this is, to make sure they secrete enough stomach acids to reduce food allergies, food sensitivities, and to complete digestion. It also makes sure that the gallbladder kicks in and the pancreas kicks in, because their function becomes very abnormal when the stomach acids are abnormal. You enhance detoxification pathways. Every single Alzheimer case that comes in here, we detoxify them, enhance detoxification pathways, and we keep them rolling then afterwards with the other good things. You boost energy metabolism. Mitochondrial fatigue is part of any neurological conditions, especially with Alzheimer's. What I really worry about is when a patient comes in and they said, you know, my brain just gets tired. I do these things I have to do, like balancing a checkbook in the morning, because I know in the afternoon or evening it won't happen. And these are the patients I really watch, because our first appointment is pretty intense and I'm bombing them with questions and I'm giving them lots of things to do. And then I watch their face after the exam. And some of them are just plain beat. They're done. I know they have low mitochondrial function, not much reserve, and that affects the brain dramatically. One of the first to suffer is the brain. These are the people that have a hard time focusing for any kind of time. So boosting mitochondrial function is a must-do in recovery of Alzheimer's. It is a must-do. Calming the mind is critical as well. What I'm really meaning with that is get the stress response normalized. Stress is not going to go away, folks. It's going to be around us. But it's a learned response. And how we react and how we process stress is critical, absolutely critical for our nervous system. If we overreact, for example, if you do what I used to do and overreact a little bit to some of the people in front of me in the highway, and right, we are sometimes surrounded by not such good drivers, or so we think, and if you overreact, you do that enough, eventually it becomes such a negative pathway that it becomes permanently ingrained and it becomes part of us. And it changes our very physiology. Don't do that. Don't do that. We are wired to just be a magnet for negativity. Have you noticed that a lot of us as we get older become more negative, jaded? Bleh. Yeah, it's because we have just accumulated all the negative stuff, because it doesn't take any work for the brain to hang on to that. It takes work for the positivity to be there. So you have to constantly stand guard at the gates of your mind and enhance the good things. When you walk out, there's this gorgeous blooming rose bush out there. Critical that you look at it, admire it, and feel good about it. Absolutely critical. So there's something called the limbic system. It's right at the very bottom of our brain. Yeah? And the limbic system has, as part of it, the signaling pathway to the thyroid and adrenals, our nervous system, things like our blood pressure, and our limbic system, when it gets traumatized by all the negativity, or PTSD, or abuse as a child, what it does, it can turn on permanently and give permanent bad signals to the gut, to the liver, to the kidneys, to the entire body. And these are the patients that come in with multiple chemical sensitivities. They say, you know, all I have to do is smell a little bit of perfume and I'm sick for an hour and have a migraine for 3 days. Or, you know, I hear these stories all the time. They have these increasing food allergies and you're doing everything you can with the gut to correct it. And you're doing all the right things. And they're seeing some improvements, yay, but they're not really overcoming it. And over time, they can eat less and less and less. It's that limbic system that is on. And it doesn't know how to shut off anymore. So the key is to find the shut off portion. Groundbreaking research was presented over here how to do that with absolutely astonishing results with fibromyalgia, chemical sensitivities, food allergies. I can go on and on and on. And we will cover that at some point. Okay, that's a whole other seminar also. So now we're going from, instead of working directly on the organ system, we're working on the brain, how it talks to the organ system. Fascinating, right? So with Alzheimer's, the limbic system is very, very involved. And I feel part of that is emotional. So what does base nutrients look like? So what does virtually every case of cognitive decline, what do we do? Nourish food program, so that's that ketogenic diet done the right way with very specific phytonutrients. And we put them on a wellness pack. The wellness pack includes Phytomulti, and Phytomulti is, to date, the most powerful antioxidant multiple out there that actually has clinical trials behind it. Every single Phytomulti is the equivalent of 32 cups of blueberries or 10 large Mediterranean meals that are vegetables. Yeah, so an incredible antioxidant that has also the B vitamins for recovery of the nervous system, and I can go on and on about that. It's got a very specific fish oil in it, magnesium to support adrenals. So that's wellness essentials. Vitamin D. Vitamin D is actually not a vitamin, it is a hormone. And it's called a hormone in Europe, but here it's called a vitamin. But it really is a hormone. It has a profound effect on all of your hormones, as well as leaky gut syndrome. Leakiness of the gut is often caused by vitamin D depletion. We make sure the digestive system is working, and we make sure we give them probiotics, and we do mitochondrial resuscitation with something that's new here, but it's old. It's called MitoBoost. I had an earlier version of it about 15 years ago and used it a lot on AIDS patients back then, as well as professional athletes, believe it or not. With professional athletes, anything to enhance mitochondrial production increases your reflex time, it increases your muscle strength, it increases your reserve, and so mitochondrial resuscitation was absolutely critical. It went out of production because the protein powder tasted absolutely awful and compliance was lousy because of it. And they finally were able to resurrect it in tablet form, and we have that now, and I'm really, really happy about it. As of about 6-8 months ago, we now carry it again. And we see some pretty incredible things with this. We just put in a patient on it that had needed oxygen and was going downhill, and I put him on MitoBoost, and wouldn't you know, within 3 weeks he was off of oxygen, and that was the only change. And we had been dealing with this for years. So it's a powerful one. Cereva is the only one item tablet that's been documented to actually be able to reverse Alzheimer's by itself. It's the only one up to date. Big clinical trial in Poland, 2 in the Netherlands, and believe it or not, a clinical trial at University of Iowa Medical School has proven that. Cereva gives you something called huperzine A, and that was mentioned a lot in the last bunch of symposiums that I Went to huperzine A, increases oxygenation as well as blood flow to the hippocampus. It's anti-inflammatory. It's got to be huperzine A, not huperzine. It also has something called PRP, which is a protein-rich polypeptide, and that is also known as colostrin. So yes, it's made from colostrum, and that also dampens autoimmune type of inflammation within the brain. This we are careful with. With some cases of Alzheimer's, it can create anxiety. Why? Because it can bring back memories so quick, and they're no longer wired to handle all those memories, that's what produces anxiety. So I tell all my patients that we put them on, I tell them about Cereva. It also has a neuroprotective effect, by the way. So if Alzheimer's is very prominent in the family, then you can use it as a protectant. Yeah, interesting product. So for type 1, that hot one, we use SPM Active, right? That's the revolutionary resolver of inflammation because it has resolvents in it. And Inflammix Plus 360. This is very similar to what I use with autoimmune disease patients. So let's say a patient comes in with rheumatoid arthritis. This is exactly what I do because it resolves inflammation. Type 2, figure out where the hormone imbalance is and work it. Restore hormone balance. Hormone replacement therapy can be done if it's acute. We are not opposed to hormone replacement therapy for those kind of situations. We're just opposed to it long term. That's when side effects start coming in. And type 3, the toxic one, we use Metalloclear with Ultraclear Renew. It increases your clearance of mercury by 87% on average the first day and a half alone. It fixes the detoxification pathways and has been shown to pull it even out of the bone. So the last resort reservoirs that the body's put it in, it will pull it out. This works better than chelation therapy, IV chelation therapy, at just a tiny fraction of the cost. Amazing. Type 4, that's the pale one, right? The lack of circulation. We give L-arginine. That's called ArginCore. Also used by athletes to enhance the muscle circulation of oxygen and nutrients. ArginCore increases circulation very dramatically. Even with the heart conditions, we could increase walking distance for those that have angina pain by 20% in just 2 weeks with ArginCore. And a traumatic concussion types, neurosupport. Dr. David Perlmutter is behind a lot of that research behind neurosupport. It is a protein powder designed for neurological repair. And Neurosol, which is a B vitamin with GLA oil, which also dampens inflammation and fixes bruised areas. Also used for sciatica, by the way. So when you look at Alzheimer's disease, it's a little bit like looking at a roof with many, many holes in it. There's multiple facets to it. At last count, we have 36 direct markers for Alzheimer's that we can measure. Studies have shown by Dr. Berdezin that if you fix just half of those, so you're doing an imperfect job here, you are reversing Alzheimer's. So you just have to go after the big players, which is reassuring to the patient and to the physician, because it sure is hard to be perfect, right? But if you go after the big players, there's an awful lot you can do. Fix half the holes of your leaky roof, and you've got it. And really, this is where functional medicine comes in so strongly, right? Because you're enhancing the detoxification pathways to affect the brain. You're affecting the reproductive system through your hormone rebalancing. You are affecting the gut, the gastrointestinal tract, because that is the second brain. It's a big part of our immune system. And our musculoskeletal system, even that is involved, because we know that by freeing up the suboccipital area right through here, we're increasing circulation like mad to the brain area. We're looking at the cardiovascular and respiratory levels. If you have snoring or some kind of sleep disorder, sleep apneas, you're decreasing oxygenation to the brain. We have known cases to be cured just by curing that. So that is a very important one. So I can go on and on. All these different facets, they combine together to bring about brain health. We have treated the brain too long as this little sphere that's floating out in space, separate from our body. It is not. It is very much part of our body, and is very much influenced by what our body is doing. If we're inflamed down here, it's going to be inflamed there. Just like these signals can affect this, these signals can affect this as well. And then we've got the signals from outside, through food, through toxins, through good stuff, has a huge effect. Yeah, we know that even a current phase is all the different things, the essential oils, right, the smells, and we know from thousands of years of history with that certain smells are very calming. It has a profound effect on our environment. It does. So as we approach Alzheimer's in a totally different way of thinking, we have to get rid of what the 20th century has taught us, this monotherapy. This one thing cures that. We have to look at it from a functional medicine perspective and say, wow, where are my deficits? What's assaulting my brain? And what is the approach that we use to reverse that? The brain is incredibly neuroplastic, as we call, meaning that it can reverse itself, it can rebuild itself, it can produce new pathways, and all we have to do is tap into that and give it the chance that it deserves. And maybe in the process become smarter, our processing speed faster. I like the notion of being smarter than when I was 25. It is possible, and let's get rid of all those old notions and welcome to the new beginning. Share with you just one story on how basic things can be. So, this is about 20 years ago. They bring in this new patient, and he was obviously in pain. Was just walking, bent over like this. So coming in for chiropractic care. So okay, started communicating with him. He's just staring, not communicating. So I looked quizzically at the daughter. Says, yeah, he's not been communicative now for 10 years. He has very advanced Alzheimer's. Okay, can't even speak, no words. So, very advanced Alzheimer's. Wow. So, I remember trying to have him stand up. He couldn't understand any of my commands to take a stand-up x-ray. Got that done. Then I looked at the BIA that we did, and I about dropped it. To date, this fella has been the most dehydrated patient I've ever had. His hydration level was 32%. Dehydration starts at 50. So I right away referred out to the emergency room, says, you need to give him fluids. This fella is severely dehydrated. His muscles and joints are just locking up. Let's get him rehydrated, and then let's get him back over here. Was back a week later, much better shape. And I gave strict instructions on how much fluid he needs, re-nourishing. Do you know, in 3 months he started talking, started functioning. By 6 months, the Alzheimer's diagnosis was dropped. Water was the only problem here. Totally stopped up his detoxification pathways. Kidneys basically weren't doing their job. Liver wasn't doing the job. And he had become one big toxic inflamed mess, which was extremely simple to repair this one time with water. So don't forget about the basics. Water, oxygen, your vegetables, thinking good thoughts, stimulating your mind. I heard from someone that Netflix just released the latest series of House of Cards. Forgive me if I'm wrong, but it's apparently a show that everybody likes to watch and binge watch all at once. Don't. Don't. Because information that's passive like that degrades the brain. It's a proven fact. It is an absolute proven fact. You don't do these things. Stand guard at the gates of your brain. What goes in emotionally as well as physically. There it is. Next seminar. You want to talk about it?
Yeah.
Okay, so this is a really big topic. Hypothyroid. Dr. Kate's going to be teaching this. And I'm really excited about this one for this reason. 50% of women at 55 have subclinical or clinical hypothyroidism, and most of them are not diagnosed. It's an incredibly big problem. And the thyroid stands very much at the center of hormone regulation. It's not just about energy pathways, folks. It's a lot more. You'll learn about that at that seminar, and I'm excited about that, about just covering that really mighty small organ. So that's our next seminar.
Note the date. Oh, sorry.
Yes, the date.
Yeah, normally it's the first Monday, but because of the holiday, we're going to have the second Monday. So July.
Any questions? Yes.
You talked about the toxins like mercury and pesticides. Right?
Yes.
What about things like exposure to asbestos or anything?
Yeah, asbestos we've not been able to link. We've not been able to link to Alzheimer's, except when you start using common sense, it could in a roundabout way. Asbestos is one of those fine particles which is very fibrous and tends to lodge in the lungs and becomes this constant source of inflammation within the lungs, causing basically lungs to fail. As lungs fail, of course, you're going to decrease oxygenation within the body, and of course the brain will suffer at that point. Anytime oxygen levels drop, your brain will suffer. However, I think the demise is so quick at that point that the patient dies of cardiac arrest or basically an oxygen deprivation before Alzheimer's sets in. So asbestos is very specific where it moves to and stays. It doesn't translocate to other areas of the body. Yeah.
How about smoking or exposure to secondhand smoke? Has that been part of the problem?
It has been. And this one is really genetically tied. If you happen to have the ApoE4 gene or the CD33 gene, smoking seems to really affect those people. If you don't have those genes, then it doesn't, as far as Alzheimer's goes. So, yeah. So the way to really know about it is to get your genetic profile done. And that was out of reach, but it's rapidly becoming in reach. 23andMe will do a very nice profile for about $300, and it's your whole genetic profile. However, for some of these key genes, there's a 20% error rate. So I'm not quite trusting it yet. There's new technology coming right along the line. I'm going to a symposium in Seattle late summer on this one, where a new company claims to have it within 1% accuracy, and I can't wait to absorb that information. And when it looks like something that we can go on, I'm gonna hit you with it. Yeah.
Are you seeing anything using Gerson for this area?
No, Gerson, we have none. Gerson has been doing a lot of things, but not as far as this goes.
Because if you look at the walls, I've watched her, incredible habit. But
Yeah.
I almost think of juicing is what she's doing
Right.
on steroids, if you'll excuse
Yes,
that.
very much
And
so.
of course, he also used coffee enemas.
Right.
Coffee enemas increased glutathione 600%.
I know, but there's other problems with it. So we use coffee enemas with liver cancer, but that's the only time that I feel is appropriate. You get an opinion. There's not much research there, so you get my opinion there. Yeah. Yes.
You say you do a lot of research on neurology. Do you have any information at all on neuropathy?
Neuropathy is really interesting. It's like micro bits of Alzheimer's on nerve endings. That's what it reminds me of. So it's usually in the peripheral extremities, right? It doesn't have to be, but usually where there's the least amount of oxygenation, so it's more prone to it. So the first thing we do with neuropathy is just ask the basic question: is it getting enough oxygen nutrients through the blood pathways? Okay, if the answer is yes, then secondly, you've got to go to, okay, what kind of toxin is affecting the mitochondria, the little drivers of nerve function? What is slowing it down? Because now all of a sudden it's not a vascular disease, but it's a mitochondrial disease. There's two different types. And for the mitochondrial disease, what we do is we give them the MitoBoost. We give them a lot of very specific fats for repair. We give them coenzyme Q10, as well as something called lipoic acid. And in most cases, these mitochondrial neuropathies reverse themselves in 3 months' time. In most cases. The ones that are a little tougher are the ones that are a mix of both vascular and mitochondrial. Those take longer and a little more persistence. We use something called acoustic compression on that, which is a sound wave therapy to increase circulation to the extremities.
So you have a quick success with that then?
Oh yes. Yeah.
Because I did have
Yeah, neuropathy.
very painful.
Yeah, neuropathy is nasty. It's nerve endings going, yeah. Yes.
Have essential tremors ever been tied in any way to Parkinson's or Alzheimer's?
Essential tremors. Tremors is a whole different field of neurology. It is very much a central nervous system problem. It's usually a sign of something else oncoming. It's where we have a firing of, when a nerve is really, really irritated, it comes closer to the threshold of what we call discharge. Okay, usually it takes quite a bit of stimuli, and boom, there goes the nerve, right? But this one is really close to its threshold due to some excitatory agent, which is usually some neurotoxin. And when that neurotoxin is present, it takes nothing for it to start firing, and that's the essential tremor. So it can be precursor to MS, Parkinson's, Alzheimer's, a host of things. It's really important to differentiate because there's a lot of different kinds of tremors out there, some more harmful than others. So, big topic. Yeah. Yes?
Dr. denBoer, I've read a lot, I've just seen more information about Lyme disease on the increase.
Lyme disease, yes.
And also that if that goes undetected for years, that it can cause dementia. Have you?
Yeah. Lyme disease and dementia is actually very closely associated. Lyme disease is incredibly controversial. And the reason for that is that we don't have a really good way to diagnose it. It's the problem. Lyme's tends to hide itself in a biofilm, so it's not detectable. The immune system can't detect it. So it's a really smart agent. And there's a lot of conditions that mimic Lyme disease. So a lot of practitioners that are just starting to dabble in this field are calling everything that comes in with fibromyalgia and chronic fatigue and depression, they're calling it all Lyme disease. And so there's that specter out there. So then there's a bunch of doctors say, well, Lyme disease, that doesn't really exist, but it does exist. But there's a lot of Lyme-like presentations also. The good news is that Lyme's disease, its one commonality is an overactive central nervous system. That's part of the fatigue. That's part of the brain fog. It's partially become a system that's supposed to be off within the brain, the limbic system again, and now it's on full time. So it's almost like it's been damaged by this stressor. So that becomes part of the problem. And if you can eliminate that overactivity, all of a sudden the immune system is now ready to attack the Lyme disease specifically, and they can be cured in 3 months' time. 3 months. Yeah.
Are you seeing an increase in that? In those kind of patients?
I am. It's pretty dramatic. I was hedging a little bit, I know. I'm seeing a very dramatic increase, but it reminds me a little bit. I've been in practice long enough, almost 30 years now, and I've seen waves of different things come in. When I first started practice, everything was candida. Everything. This was in the 80s. And there was so much of it out there, it was unbelievable. I'm sure, looking back now, that it was tied to the incredible use of antibiotics back then, and just the fact that the new food pyramid had come out just 7-8 years prior to that, and everything tasted awful because fat was bad. So we started adding massive amounts of sugar to everything. So the combination of antibiotics and sugar created this whole yeast epidemic back then. Does that make sense? So the conditions were perfect. And then I can go on, and it'd be really cool to write an article about this. But Lyme disease right now is so prevalent, and I think it's because of the increasing load of heavy metals as well as neurotoxins combined that's making us more prone to it. Because you can be bitten by a Lyme-infected tick and not get Lyme's disease. In fact, that's what's supposed to happen. Right? Just like I can be exposed to a cold and not get it. Right? So it's really where the host becomes very prone to getting it. That's the problem. And that's where we're at today. So yes, we're seeing an incredible increase in Lyme disease. Yeah. Did that make sense? Yeah.
For people who aren't very well disciplined like I am regarding what we eat,
Yeah.
I've seen advertised, I haven't checked it out further, something called Texas Superfood, which is supposed to have a whole lot of super ingredients.
Yes.
Would that be a good supplement for anything that we're talking about? I mean,
Well,
are you familiar with the product?
Well, I've heard the ad once, and my warning bells went up immediately because it basically claimed everything that it would do. And whenever you see something like that, wow, I tend to. Is it organic fully? Is it harvested when it was at its peak? Is it processed within 24 hours? Is it cold processed? Does it have any additives to it, right? There's all these unanswered questions, and if you're taking anything that's concentrated, it better be clean, it better be real, and most of them are not. So I'm really picky when it comes to concentrated things. Yeah? So, yeah, kind of complicated. If you need superfoods, the best that I have seen is phytoganics. One little scoop is equal to 8 pounds of all organic fruits and vegetables. And if I had not the discipline or traveled or just didn't have access to good food, that's what I'll do to re-nourish myself.
Is that metagenic?
Yeah, phytoganics is. Yep. Yes.
What does aluminum have effect on this?
You know, aluminum has lost its specter a little bit. It can be responsible for Alzheimer's, but a very, very tiny percentage. So back in the 70s and 80s, we thought, oh, this is it, because aluminum was found in higher quantities in Alzheimer's brains on autopsy. But now we know it's pretty much all heavy metals, not just aluminum. And aluminum seems to be just, yeah, excess any metal is not good. And aluminum would be one of those. Yes?
When you use the word Roundup, are you talking about the Roundup that was always called Roundup? Or are you talking about all vegetation killers?
I'm talking about specifically about Roundup called glycophosphate, but glycophosphate is also a lot of the other brands. So look at the label, glycophosphate.
I thought the labeled Roundup was not allowed any longer to be used. We're not gonna-
That's Monsanto product.
Oh, yeah, it's used all over the place.
Yeah, you can still buy Roundup, I know you can. Yeah, but it's glycophosphate, that's the chemical name.
Hasn't it been outlawed for agricultural purposes?
No, they use it like water. Yeah. Any other questions? Yes?
What about hyperbaric chamber?
Ooh, nice one. I love hyperbaric chambers, and yes, we are going to go there at some point when we're building downstairs. Absolutely, it is wonderful, wonderful for regeneration of nerve cells. Other things too, but especially for neurological conditions, whether you're talking seizures, MS, Alzheimer's, hyperbaric oxygen treatment is phenomenal.
I was reading about that with Parkinson's.
Yeah. Yeah, it's a really nice adjunct. You can't rely on it by itself, but I look at it as kind of a turbo on an engine, right? You're just accelerating the whole process. Yep. Yes?
Infrared sauna?
Infrared sauna is awesome. It's the best way to get rid of mercury and cadmium.
Okay.
Yeah, sweat it out, especially cadmium. Yeah.
Okay.
Yeah? Beautiful. All right. It's a wrap. Thank you.